in 3, 2, 1. Deramax and Osteoarthritis. Can't spell it, just about barely pronounced it. This guy knows all, tells all, is all to all people. Dr. Joel Saylor of Town and Country Veterinary Clinic.
Not sure about all of that. We're talking about truth in advertising again.
Sure. So,
no, I do want to talk about Deramax and osteoarthritis because, again, it's October. And so we should start be getting our little cooler weathers coming in, and pretty soon we're all going to be complaining about the cold weather and wishing it was warm again, and then only to be followed by, gosh, I wish it would get cooler again. So we're never happy in Florida.
No.
But when the cooler weathers come in, the osteoarthritic dog starts to become more painful. If anybody has arthritis out there, human-wise, you know on colder days it hurts worse.
Sure.
Okay? And the dogs are no different. They just don't talk about it. Okay? And so what you'll see in those dogs is that, it's when it's colder weather, you'll see them trying to get up, a lot slower. Exactly. And so those are the ideal dogs for these non-steroidal anti-inflammatories. One of our favorite ones is Deramax. It's a nice once-a-day product. It's also what we call a COX-2 inhibitor, and it's COX-2 specific, which means it doesn't drift over into the other receptors, so it's less likely to cause some of the symptoms that we see with stomach irritation, although any non-steroidal anti-inflammatory, if you don't use it cautiously, you can cause problems.
Okay.
But we do like to use ones that are more specific, not just selective. Right. Examples on the human side would be drugs like Celebrex and those kind. Those are COX-2 specific. And so the nice thing is it's once a day. Right. And what I usually recommend if you're not sure is trying a 2-week course, if not Deramax, one of the other NSAIDs, for a 2-week time and see exactly how much improvement in movement you see. And after that 2 weeks time, a lot of times because this stuff's been happening so slowly, you don't really realize how much they are in discomfort. And after that 2-week period, you usually notice that if you have arthritis, the dog's way more active and running around and feeling young again. So those are the dogs that you want to long-term manage with that. So they can get back to playing, they can get back to having fun. There's no need for them to really hurt. And this is a good time of year to try and focus on that and spot it.
All right, and we'll be back right after this message.